Again, so my name is Jada. I'm the founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers like birth doulas, postpartum doulas, lactation consultants, and mental health therapists. We were all in person until the pandemic, and now everything is available virtual. So virtually, we are here for you if you need any support. Today, we're also joined by and sponsored by Bodily, which we're going to talk about. So we have Tovah Haim today here, who's the founder and CEO of Bodily, which is a company that is empowering women to take control of their health through educational content and modern products backed by clinical research. She resides in Brooklyn, New York, with her family and her 2 children. We also have, and you're going to get to hear from everybody, will tell you about themselves today. We also have Dr. Nanika Coor. Nanika Coor, PsyD, is a licensed clinical psychologist and the founder of Brooklyn Parent Therapy, offering therapy to parents who don't want their childhood history to become their parenting story. Grounded in the principles of nonviolent communication, RIE, resources for infant educators, and respectful parenting. Her work focuses on psychodynamic psychotherapy with parents who are trying to break intergenerational cycles of parent-child disconnection. Nanika founded Brooklyn Parent Therapy to hold space for parents so they can better hold space for their children. And we also have Olivia Bergeron, LCSW, a psychotherapist and parent coach who founded Mommy Groove Therapy and Parent Coaching to help parents successfully navigate the huge changes that come with having a child. A mom to twins and a singleton, Olivia understands the demands that come with parenting in New York City, and she is proud to help parents find a way to stop yelling and start connecting with their child. She speaks Spanish and French fluently and offers her services in these languages as well. So we're going to have everybody introduce themselves in a moment. I just want to kind of talk a little bit about how today we are talking about mental health tips for new parents during really trying times. So we really want to be here to talk about different triggers that may come up, different self-care tips. You are new parents who are going through, or soon to be new parents, going through incredible transformation and time in your lives. And not only are you going through all of these transformations and what it means to become a new parent, but you're also having babies during a time where we are in the middle of 2 very big crises. We've got the pandemic that has upended life as we know it. And we also are at a national reckoning of the systemic racism that our country is built upon. And we are birthing and being parents through these times. And we just want to acknowledge that there's a lot, both externally and internally. And we are here for you to support you through these times and to talk about how, what is normal, when to reach out for help, and just to kind of field your questions as well. So any questions that you do have for us, we have some of your questions from ahead of time, but you can also place them into the question box. So why don't we start by hearing, we'll have Tovah introduce, why don't you introduce yourself and,
Sure.
And then we'll move around. Thanks.
Hi, I'm Tovah Haim, and I'm the founder of Bodily. We are a platform that provides evidence-based information on birth recovery, pregnancy recovery, and breastfeeding, and then also modern products that you can feel really great about and are developed together with medical experts. And I am a mother of 2 and actually just gave birth in mid-March in New York City at the outbreak of the pandemic. So I've been living that in a very, very real way, had 2 really different experiences across my pregnancies and postpartum, and am so happy to be a part of this conversation.
Thank you. All right, Dr. Coor.
Hello all. I am Dr. Nanika Coor, and I am a clinical psychologist who provides therapy for parents in Brooklyn and New York State. I work with parents who have found themselves in a position where some of the things that they grew up with that they were not pleased with in terms of parent-child relations are trying to sort of change that story and do something different and parent in line with their values more. And I have seen lots of parents, and I've been very, very honored to help parents sort of break the cycle.
Thank you. Olivia.
Yeah, so my name is Olivia Bergeron. Thank you so much for having us. I think this is really great, Jada. I really appreciate it, first of all. I do have a psychotherapy and a parent coaching practice called Mommy Guru Therapy and Parent Coaching. So it's mommyguru.com. And I really started my work because my daughter was 2 when my twins were born. And so I saw there was just a real dearth of support and help for parents out there. And I saw how challenging it was. So I decided to really orient my practice and orient myself towards helping parents launch their families in such a way that I just have my audience full up. Yeah, so getting folks off to a good start. Oftentimes, I think people don't realize how hard it's going to be. And I think we have an image of parenthood as kind of sunshine and rainbows, and in the media it's portrayed a certain way. And then when you experience it yourself and it doesn't quite come off that way, I think people oftentimes hit a wall. And they feel like, what's wrong with me? What am I doing wrong? And so I think, again, providing parents with that kind of support, both with their own mental health, their own well-being, but also then once their kids are a little bit older, figuring out how they can navigate parenthood, because as Nanika said, oftentimes people want to parent in a way that they were not parented. And so making that shift, but I think people know what they don't want to do, and oftentimes they don't know actually what to do. So parent coaching can be really exceptionally helpful, I find, in helping people navigate and find their North Star, basically. So yeah, thank you for having me.
Yeah, thank you, everyone. And I think we're all going to talk a little bit. We all are moms here and all have different experiences of the early newborn phase and the early parenting time. And so I think we'll get to that in a little bit after we kind of lay down some of the foundation. But I think we want to normalize for everybody that there are so many different experiences, just as there are of how you might give birth, what happens on the other side when you have a baby, and those shifts that can happen in us. And so, we just want to kind of welcome everybody here and know that whatever kind of experience you are going through, just to normalize that there's potentially somebody else out there having these questions and thoughts and thinking about it. And sometimes it's hard to bring those out into the world. So we just kind of want to put out some of these questions so we can talk about it. So first, the basics, of course. People always ask this question, if you could illuminate for us, what really is the difference between baby blues and postpartum depression and anxiety? There's been a lot of talk about this. You'll hear sometimes people talk about, oh, I had postpartum, is that just that word? Like, what does that mean? I am postpartum, I am depressed. I think people don't talk as much about the anxiety piece that could be for some people. Could you tell us a little bit more? Olivia, do you want to start?
Sure, yeah. I mean, I think people often conflate the baby blues with postpartum depression and even postpartum psychosis. And obviously they're vastly different things. Now, just to start out, the baby blues, the literature will say it's between 50 and 80% of new parents will experience that. I think it's closer to 99, just because, what is it exactly? It's transient moodiness that occurs around before 6 weeks, around up until the 6-week point, and it doesn't last more than 10 days. So if you're feeling, and I liken it to, I'm a visual person, so I liken it to, the sun is out, but clouds are passing over the sun. In other words, it's you're kind of laughing through tears. Your hormones are fluctuating, so you're up and down, but you're not feeling bad all the time. Okay, and if you're feeling bad past the 6-week mark or so, or if it's lasting more than 10 days to 2 weeks, then it's not the baby blues, it's something else. And the baby blues we find across cultures, across time. So we know it's not just a Western phenomenon. And we see that, they say when the milk comes in, the tears aren't far behind. So generally it peaks around day 3 to day 5 or so, and that's when hormones are really, really up and down. And when you think about it, your hormones are crashing, right? You were pregnant for 40 odd weeks, and all of a sudden you're not. And then as a consequence, you're just all over the map. So that's really, those are the baby blues. Postpartum depression and anxiety, on the other hand, is not, again, it's not in the same realm. It is actually the number one most common complication following childbirth, and people don't realize that. So more common than diabetes, more common than these other conditions that we associate, that we actually screen for. Unfortunately, we don't screen as much for this. So just know that it's really common, but it's not normal. And that, I think, is an important point. In other words, but what does postpartum depression look like? I think, to your point, oftentimes it manifests as anxiety. In my experience, more often I will see folks experiencing or presenting with they're on edge. They can't sleep. They're on racing thoughts. They can't rest when the baby's resting or sleeping. They're just always, it's all about being in the future. What if this happens and this happens? They're 10 steps ahead, gaming out what's going to happen. And it's a pretty dark future. It's not a happy place that they're imagining. And so it creates a lot of suffering in the present because they're so, again, they're 10 steps ahead. So it can manifest as depression as well. But more often I see it as an agitated depression. So it's more often presents as anxiety.
Thank you. Yeah. And Dr. Coor, I see you shaking your head if you want to jump in there.
Oh, I mean, everything Olivia said. But yeah, I was going to say that often what I see too is the agitation. So it doesn't seem as melancholy as it seems very, very tense and lots of anxiety. Yeah.
But people, I think that, okay, it's not depression. This isn't depression. I'm not depressed. I'm just on edge. I'm yelling at my partner. I can't settle down. I can't eat anything. I can't sleep. So that's not depression, which I think does folks a disservice, the fact that they don't know what the presentation actually looks like. And so I'm appreciative, Jada, kind of you helping get the word out, because this is really, I think, critical. And I don't know if New York City is a particularly anxious place. I think probably it is.
Yes.
So oftentimes, again, it can present as more, as Nanika was saying, more of a, a depressed mood, kind of a mopiness, a sadness, can't get out of bed, kind of a presentation. But oftentimes I find that the vast majority of the time, I think it presents much more as anxiety.
And when would you say that this presentation of these feelings moves? We're going to talk a little bit more about, symptoms and how we know when to reach out, but when would you say it often peaks?
The peak is around 3 months postpartum, month 3. But actually it can happen during pregnancy too. That's why calling it postpartum depression is really a misnomer, because oftentimes, about half the time, I would say it starts during pregnancy. And technically the literature will say, it goes from pregnancy on until the first 12 months. But if you're nursing, that can certainly, and if you haven't been treated, then I don't think at day 366, all of a sudden now it's not postpartum depression or anxiety. I think it still is.
Right, and I think that's something that we, definitely don't. I would love to hear more from you guys about, in terms of this happening during pregnancy, or if you were already prone to depression and anxiety. Is it different than being pregnant, right? Are you still you, and now you're pregnant, and you are more prone potentially? I know that literature suggests that, but do you find, how would you advise somebody, say, who knows that they have experienced some depression and anxiety in their past? What would you say that person, should they be checking in with their care provider that they've worked with before, a mental health therapist, or if they're not in touch while they're pregnant? Like, what do you find with your clients who are reaching out to you?
I say cope in advance. If you know you have a mental health history, if you have any depression or anxiety, both you or in your family, looking for a provider at 3 o'clock in the morning when you can't sleep, when you've got a screaming baby, that's not the time. I mean, you can certainly do it if you have to, but ideally you would make contact with the provider ahead of time, hopefully during pregnancy, if not shortly thereafter, and have that, make that phone call, do the screening ahead of time so you know who to call just in case. A little preventive maintenance, I think, can go a really long way in that situation. So I think you're reaching out early, again, just to make sure that you know who to call. You've got somebody lined up. And I think if you have a history of again, depression or anxiety, and for example, a lot of people go off their medication to get or stay pregnant. The relapse rate is really high during pregnancy. So know that, but I don't think that, I think you can also take steps to mitigate symptoms and do something about it. So you're not helpless in the face, but knowing that, I think it can be really helpful to get people to take action, do something where you can.
Yeah.
I think it's really important to note that when you are pregnant and postpartum, you have really dramatic changes to your body that are happening hormonally, and these changes, you don't experience this level of change at any other time in your life. And so there's a lot of things that happen to your body that in any other state you would be very surprised to occur, but in pregnancy and postpartum, like a lot of things can happen. Your hormonal levels, estrogen, progesterone increase over the course of pregnancy by 1,000%. And then when you birth the placenta, which is an organ that your body creates to do a lot of different things, but it also produces these hormones. When you birth the placenta, given that that was the source of these elevated hormone levels, you have a very dramatic drop over the course of 3 to 5 days, and your hormonal levels, progesterone is one of them, decreases by 1,000%. So, it's one of the reasons where, you know, even if you're not prone to depression or anxiety, you can experience these things at a level that you would feel very abnormal for you. If you are prone, you could be more at risk because your body is doing an amazing thing. It's creating an entire new human by a course of, you know, a bunch of crazy processes. And when you birth that human in the placenta, there's a lot of changes that transpire coming out of that.
Absolutely, right. So many big changes, and I'm echoing through somebody, I think. Am I? So incredible changes, and just a really big sense, a big difference in the sense of ourselves, our whole self, right? And who we might have thought we were starts to shift. So, you know, I think everybody here might be interested. Let's just hear a little bit. If you, you know, yourself want to share a little bit about your early postpartum experience, just so that we can give kind of a breadth of, you know, if you want to share a little bit with our community, what that might have been like for you, or some little thing that came out for you. Tovah, you gave birth most recently, if you want to share a little bit.
Yeah, happy to. So my most recent experience was super different than my last experience and my first experience. One of the things that was so different is that this time around, I didn't feel the dramatic emotional upheaval that I felt last time. Last time I was crying for no reason all the time at anything. If I saw a picture of my baby and he was in the next room, I would cry. Some of it was euphoric. Some of it was, I don't know, it didn't feel like sad, but it just felt overwhelming. And that took place for a long time. And I felt, it actually had me feeling like unhinged. I felt very, very not me. I wasn't in control over that. I had no, I didn't expect it. People told me you'll be very hormonal and emotional afterwards, but this was very, very dramatic. And so that was my first experience. My most recent experience, I was in the pandemic and at the outbreak when we didn't know, I didn't know if I just had COVID 2 minutes ago because it was just breaking out. The hospitals weren't ready yet. And we didn't yet know like the basics and how to protect ourselves, but we were seeing the numbers climbing. And so that was obviously very, very scary. But other than that, I didn't feel all of that kind of emotional upheaval. And that made me feel all kinds of other things like, do I love my daughter enough? Am I not feeling the connection with her? Why am I not crying all the time? So that was kind of like one corner of it. And then, you know, you're sort of alluding to the identity piece. And it very much rocked my sense of identity to the core. The idea of being a mother, and Nanika, like, I love your practice so much. They like all of the mom baggage, you know, and like now I'm mom and now I understand her from a whole new perspective, and that's very emotional. And for me, you know, my mother died years ago, and so that made it even more emotional. So much gets kicked up. Seeing your body in a very different way, not having appropriate expectations is one of the things I'm super passionate about. One of the reasons I started Bodily is so that you know what to expect coming into it, and you know that, you know, I thought that I would go back to my pre-pregnancy clothes. And that's like, so, and now we all laugh, right? But I didn't know. I didn't know that it takes 8 12 weeks for your uterus to get back to pre-pregnancy size. And so it's not even reasonable to expect that you're going to look anything other than 5 months pregnant coming out of the process. I didn't know that. And so I felt bad about myself, and I think that compounded it. Seeing, you know, as nursing, and that was important to me, but seeing your body that way, I think is another thing that shook me. It didn't, you know, I didn't know how to, felt good about it. At the same time, I didn't like feeling this way about my body. There's so much that goes into it. You know, there's so much that goes into it. What I will say is that for me on the emotional side, having expectations set, knowing what to expect, not expecting that I was going to be back to pre-pregnancy size, and then not being dramatically not that, like not having those experiences made it, I think that was part of what made the experience the second time around so much easier and happier, really.
Thank you. Thank you for sharing that with everybody. I think it's really helpful to hear just from somebody's mouth, like what kind of things they were experiencing. And actually, before we hear from you, Nanika and Olivia, could you comment a little on that feeling that Tovah brought up, this idea of like, should I have loved my baby more, or should I? I guess that should. I think that voice that often comes into our heads as new parents and as parents continuing on, of course, because I think there's so much judgment and so many people on the outside telling us how we should take care of our babies, or how we should feed our babies, or how we should hold them, or whether we should wear them or push them in a stroller or sleep train them or not, or breastfeed or not, or just all those questions, you know? So it would be great if you could weigh in on that a little, and then we'd love to hear your stories too. Yeah, Nanika.
Well, I think, you know, it's really hard, especially when you're a brand new parent, when it isn't your second time around, you know, the idea of listening to your own voice is very difficult to do when you do have all those other voices. You know, you've got the books, and you've got your friends, and you've got your family, and like everyone's telling you all these different things you should feel and do and be, and everything, you know, we're all individuals. It's going to be so different for each one of us. It's not, you know, it's such a unique thing to a person. I mean, Tovah is saying, you know, even between babies, like you're the same person, but totally two different experiences. And so it's really, you know, so good to listen to yourself and what feels good between, like, what are you and your baby? Like, what's going on between you and your baby, and what feels good in that space, in that bubble of the two of you. And I feel like so many answers are in that space. And yeah, but it is hard, right? Like when you're brand new at it, you really just don't know. You have nothing to sort of grab onto. So I find that sort of taking in the things, you know, you take in all the information, and you sort of take what resonates with you, and you leave the rest, and sort of try to really trust yourself.
Thanks. Olivia?
Definitely. I think that there's a million different ways to get to the goal, which I would imagine is a healthy, happy parents. And just because somebody does it differently next door, down the block, doesn't mean that you're doing it wrong. And, you know, coming to a sense of being an expert in your own child, which to Nanika's point, I think is you don't feel that way initially. And I think that anything you do for the first time, you feel pretty awkward at. You don't feel like you're the expert. And yet, inevitably, you've been with your child the longest. You know your child the best, better than pediatricians, you know, better than doulas or nannies or grandparents. And so developing a sense, I think, of confidence and competence comes with time. But you can get that for sure. But I think, like you said, Nanika, like following, you know, trusting your voice, and knowing that, you know, nothing that you do is set in stone. If you go down a path and it doesn't start, you know, this stops working for you, then you do something else, or you try something else, and then giving yourself permission to try things out, because again, you're doing this for the first time, or maybe the second time, and it is, I think, incumbent upon the folks that are around new parents is to provide levels of support, and to let them know that, you know, there is no one right way to do it, basically.
And on that note, thank you. How do you think, and we're going to pepper in your stories, but it made me think, I want to ask you a question first though. How does somebody, in trying to trust their gut and check in with themselves, right? How do they know when it might be time to actually reach out for professional help? Because I think, you know, reaching out for help, talking about mental health is still quite stigmatized in our society. And I think especially for Black and brown moms, it's even, you know, harder sometimes to find mental health support. And I think that's something that we really want to acknowledge as well, that there are these, the way our society is structured and what is happening, and that it's different for each parent and what they're doing. But I think that there is a real challenge for people to reach out, or it's very easy for, in many communities, to kind of, not easy, but common to just say, this is fine, this is how it's supposed to be, or I guess I'm normal, or it doesn't matter how I feel, frankly, because I have a lot of other things. I have to put food on the table. I have to do whatever I have to do. Right. So I would love to hear from you, like, how does somebody know to reach out for help, and what can they do?
I think it's really tough the first time around if you haven't been a parent before to figure that out. And sometimes just because I think a lot of folks just assume, well, this is just how it's supposed to feel. This is just how it is. It doesn't feel good, but this is normal. And I think if you're in distress, there's no need to suffer. You know, postpartum anxiety and depression are very treatable. The folks that I work with get better, and you know, and that to me is so knowing that you don't have to suffer. I think a lot of folks will kind of white knuckle it and try to get through it, and eventually they hit a wall. And I think that creates, like I said, needless suffering. And I think that the more folks know that what is normal, what is not, I think that the more that they will be able to reach out and get the help that they need when they need it. But that being said, I think that, you know, we as providers can provide that bridge to help. And I think that, you know, if you are, you know, if you're suffering for more than a couple of weeks, if things don't feel right, I think trusting your own gut and knowing that I'm not doing well here. That doesn't mean that you're a failure. I think, again, a lot of people, you know, maybe it's a New York City thing, they feel that if I'm not knocking it out of the park, then I'm failing. If I'm not feeling amazing all the time, if it's not sunshine and rainbows all the time, then there's something wrong with me. And I need to kind of put on a brave front and just pretend, because I think oftentimes, you know, we compare our insides to other people's outsides. So we see other parents and they're all put together and they got makeup on and they're doing great. And we feel bad, like, oh, what's wrong with me? Why am I not feeling that way? Why am I not looking that way? And I think, again, that's unfortunate.
Thank you. And Nanika?
I mean, I agree with all of that. And then there's also the piece that you were talking about, Jada, the piece of everybody sort of around you, possibly culturally, the stoicism, the sort of like grit your teeth and go forward, right? And you just keep going, and feeling like, what if I can't do that? What if that doesn't feel right to me? And you know, sometimes your friends and your family aren't people who would turn to mental health providers, and that doesn't mean that you can't, and it doesn't mean that that decision is for you. And you know, I always say that, you know, the best predictor of a child's well-being is their parents' well-being. You have to really take care of yourself. You have to take care of yourself. And if you're feeling like overwhelmed and like things don't feel right, reaching out is the best thing you can do for yourself, but also for your child.
I think it's not a weakness, it's a real strength. You know,
absolutely.
Because I think that I think oftentimes, in many cases, we feel like I shouldn't need the help. I should be able to do this. And those shoulds imply an awful lot of judgment, and misplaced, needlessly so. But I think that, you know, if you do acknowledge, you know, if you had a physical medical ailment, you would get help. You wouldn't hesitate. And so I think it demonstrates strength to be able to say, listen, I'm having a hard time. I'm going to do something about it. So you don't just have to suffer.
I actually think that even going even further, as someone who gave birth during the pandemic, where you are locked up alone, or you know, with whoever you happen to be quarantined with for support, if you are quarantined with someone for support. My sister gave birth just 3 days before I did, also in New York City. And I think, you know, for me, I'm like aware of the stats. I know how many challenges are normal to encounter in postpartum and through breastfeeding. And so for me, reaching out is something that now, having gone through it, that's like my default. I am going to reach out. I'm not even going to hesitate. I'm not going to wait. I'm immediately going to reach out. You know, other people, and I think especially people first time around, me first time around, my sister first time around, and this was her first time. I didn't feel like, well, this isn't bad enough for me to reach out. And it took me, I don't know how long before I reached out with my first, not in a pandemic, before I reached out to a lactation consultant. But when I did, finally, I realized there were so many things I could be doing differently that would make it easier for me that it wasn't an issue. It wasn't an issue enough for me to reach out for help. And I think that especially when we are as isolated as we are, I think that no matter if like everything is amazing, everything's perfect, it's sunshine and roses for you, still reach out. Just default, reach out to somebody. Maybe it's a lactation consultant. A lactation consultant can actually say like, oh, heads up, I think you might be crying a little bit more than I typically see at this point. Reach out to, you know, there's coaches of all kinds who can help you, like postpartum doulas. There's people who can help you with sleep training, like professionals in this field. Hope if you're not there for yourself to just default to reach out to a therapist, reach out to somebody in this constellation of service providers, because chances are they can help make something easier or identify for you that somebody else could make something easier that you don't even realize is more challenging than it needs to be.
Thank you, Tovah. Absolutely. Oop, I'm echoing again. So I think that's so right, spot on, is reaching out, and whether that is, you know about the professional resources, and of course Boober is a resource for all of those service providers who you might want to talk to. But I also always say in our postpartum, like preparing for postpartum class, you want to think about who makes up your circles of support, right? You have these different people in your life who are our friends and family who you may not be able to see. And that's part of why we're doing this call. And we want to talk about some of the tips and things people can do, because during COVID, we are not able to have the grandparents over necessarily. I mean, this is crazy. This is the first time in, I want to say, I'm not going to say first time in history, but first time in a long time in history where people did not have the help of grandparents. They're not able to hire help that they might have hired, like an overnight postpartum doula or a baby nurse, all of that. So you might not be able to have your friends come over, very likely. So who are the people you could still call in the middle of the night? Who can I call and cry to and say it's not normal, or something feels weird, or I feel fine, but I just need to express this experience? Because we're also healing from the birth. And that's the other big piece. I think it's not just that you have a baby. You also, your whole body just went through an incredible transformation, right? So I think thinking about that as well. And I think maybe if we could, let's talk about a couple of self-care tips or things people can do. Maybe they're not ready to reach out yet. They don't know if they should or shouldn't. They're thinking about it. They're debating about it. If you do want to reach out, I'm going to put the information of these wonderful therapists who you can reach out to, but maybe you're not ready for that, or you're not sure, or you're feeling a little off, and so some tips, some things that people can do while they're at home.
I think self-care is the base of the pyramid, that's really upon which everything else builds. I think a lot of parents take exceptional care of their children and not such exceptional care of themselves. And again, you do that for a little while, but eventually it does take a toll. And I don't think it's being selfish. That's something that I hear often. Oh, if I take the time out for me, then that feels selfish. It feels like I shouldn't do that. Whereas I think it's essential. I think it's critical, and it's certainly not selfish, because your child needs you to feel good. And so just basic self-care that I run through with clients. Are you drinking enough water? Most folks are dehydrated. Certainly most nursing moms are dehydrated. Do you have water stations set up around? So wherever you sit with a baby on the couch, there's always water within arm's reach. And that's something a partner can help you do. Make sure your pitchers are all filled, or your water bottles are all filled up. Are you eating regularly? one-handed foods if you have the baby in your arms. And, you have a hard-boiled egg that's already been peeled, pulled it out of the fridge. Hummus and carrots, sticks, already ready to go, in the fridge on a plate. Yogurts, things that are easy and quick. But making sure you are eating. I think a lot of folks skip meals and they're so just caught up in the baby care, at least initially, that they forget to eat. Making sure that you're still taking your prenatals even after giving birth. That's a really key one. And plus, and even a fish oil pill, those are pretty big pills, so it forces you to drink more water. Making sure you're showered every day and you get dressed and out of your PJs. I think in these days,
I'm like, wait a minute.
Yeah.
Let me check if I put on my real pants or not for this.
Let's not pan down. I think that when you don't shower and you get into that kind of mentality, it feels like you're kind of sick. We're kind of we don't shower, we don't get dressed, we're kind of just blah. So I think that's just a small step, just to kind of get refreshed, take care of yourself. Trying to get outside, get some sunlight. I know these days it's a little tricky, but if you can don your mask and head outside, sunshine is really, really critical. I think if you're in a dark kind of apartment with the curtains drawn all the time, it feeds into your own your own depression, your own sadness. When people get those sunlight lamps that you can use in the winter, but I think if you just open up your windows within a half hour of getting up every day and sit, if you want to nurse or bottle feed next to the window, just getting some vitamin D, that's really helpful. So those are a few tips.
Thank you. And Nanika?
One of the things that was really important for me was just prioritizing. Olivia sort of alluded to this taking care of the baby, and then you sort of forget to take care of yourself. And it was really important to me to take care of myself. It was so important to me to feel up to the task, right? So I really did prioritize, even if it was just 5 minutes. It was like, talking to the baby and saying, I'll be right back. I'm going to go to the bathroom by myself. I'm going to, you might fuss a little bit and I'll be right back with you. And just even that, just giving yourself 5 minutes to just think your own thoughts, breathe, have like the 5 minutes where your body belongs to yourself for 5 minutes and all of those things. I mean, just little pockets of the day, like that was really, really important. And I really recommend just, it's not selfish to just take a moment for yourself.
Do you think that if people think it is selfish, because some of us are wired in a certain way and we had a certain upbringing, which may lead us to have certain judgmental thoughts and hardwiring to never feel good enough or whatnot, right? And lots of these things that come up. How do you help somebody who's not gone into therapy yet to deal with that? And I think, can you give a little extra on that? Because I think that's one of the things that maybe even keeps people from going to therapy. And I also want to kind of acknowledge that sometimes it doesn't have to be a whole big therapy. You don't have to think about this time as going to therapy, right? I think I want to address that because a lot of people find that so overwhelming, right? And maybe they just need one conversation to start feeling better.
Yeah, I think people can have a session or a couple sessions. It's I'm sure Nanika, it's the same with you. No one's locked into a certain number of sessions, and the goal is always to get people feeling better fast. Now, not in 6 months from now, because they don't have time to waste. Frankly, their hands are literally full with their child, so they need to feel good. Yeah, so I don't know if I've lost my train of thought a little bit, but
I think. You were sort of talking about what if you've been sort of brought up to believe that you have to be sort of self-sacrificing all the time, right? And because I'm a person who encourages parents to see their children as full people, like from the day they're born, I sort of think of what are you modeling, right? Like if you're not taking care of yourself, what are you teaching your child about who you are and about who they are? Start from the beginning. I'm an important person, you're an important person, everybody's needs matter, not just yours, not just mine. Everyone can get their needs met here. And just knowing that part of taking care of your child is taking care of yourself. I mean, it is, you are doing something for your child by taking care of yourself. That is doing something for your child.
I think too,
Totally.
parents will come in if, if they have a perfectionistic streak, and they feel like they're never good enough. I think oftentimes what drives them into therapy is they don't want to pass that down.
Mm-hmm.
They don't want their child to feel the same way. They know how hard that is. They know how hard it is to live that way and never feel like you're measuring up, never feel like you're succeeding. You're always failing. And so I think that can be a strong drive to, okay, I don't want to live this way. I don't want to pass this down to my child. And so let me do something about it. And I think that, again, it's not a mindset that's, perfectionism, I think is, I guess maybe in some realms it can help you, but I think oftentimes it gets in the way, and it really is detrimental. And because there's always that sense, I'm never good enough. I'm always failing. Even if it's, if it's 99%, it means you're failing. It has to be 100% all the time. Well, perfection doesn't exist. So in other words, you're always going to be failing. And so if you transmit that to your children, that's oftentimes what people don't want to do.
Yeah.
I also think something that's really helpful, also again, especially in COVID, is for self-care and for kind of all of this, is reaching out to a friend, to a family member, whoever it is, just like in it, and doing a video call, not just an audio call, like seeing somebody else who is your friend that's not the baby, reminding yourself like you have these connections. You can't have this connection physically right now, but they're there for you. Sometimes that person can be like, you look really tired, or you need a shower, or whatever. Especially if they're close with you, they'll kind of like give you the real and hopefully prompt you to take that, 10 minutes with the baby in the bouncer next to the shower while you take the shower. But I think that reaching out and actually just making the time, you could do it while you're nursing, you can do it while the baby's sleeping, you can, whatever, just take that time to connect. I think that's really helpful too.
Yeah. And one of the issues that some people do experience is there is a fear sometimes of social services being called on a parent if they were to reach out for help. That can happen, or that fear can happen. Do you have any thoughts on that to share with our community?
Well, I think that it's if social services were called on everyone that was depressed in New York City, then a lot of kids would be without parents. So I think that's ACS is called in when there's a risk, when there's a threat, when there's imminent harm potential there. And so if you're feeling depressed or you're feeling anxious, granted, I will always ask people, are you having thoughts of hurting yourself or any disturbing thoughts or thoughts of hurting or your child? I mean, that is, the rate of psychosis is only 1 to 2 in every 1,000 births. And of all those people, it's only about 5% that will, hurt themselves or have thoughts of hurting or want to hurt their children. So it's a minority of a minority of a minority. So by and large, being fearful that someone's going to call ACS or call, children's services on you, it's unfounded. Unless there's some imminent risk. Of course, I'm a mandated reporter, so if I hear of something, it's more protective, for you and for your child. But it's rare, and unfortunately.
Okay, thank you. Yeah, I just wanted to bring that up. I mean, I think there's a lot of things that keep people from reaching out. So if somebody were to reach out to one of you, and call, what is the process like, right? If somebody is like, okay, I don't feel totally normal, I feel off, I'm a little more sad than usual, or I'm feeling really anxious, I'm Googling all the time, I can't think, I can't sleep, I can't remember things sometimes, and I decide to call one of you, right? What would happen?
So for me, it's a 10 or 15 minute, call just to answer questions and to get a sense of what's going on. And if at that point, it's the person feels like they want to move forward and schedule an appointment, then they'll move forward. These days it's all virtual, so it's phone, FaceTime, Zoom sessions. But yeah, so it's fairly painless. I think that I do try to make it as easy as I can for folks to get the help that they need. I'm sure Nanika, it's the same with you. Same
exact. Yeah, same thing. Yeah.
So you do like an initial call.
Yep, we have a call. We have a 15-minute call, and see how we feel, see if we both feel like it's a good fit, and if we want to move forward, and we get started, hit the ground running.
Great. So a little as we kind of wind toward the end of this, I think I'd love to hear from both of you about, where in your personal experiences at all, if you want to share anything with our audiences, let us know. Please, like Nanika, if you want to share a little bit.
Well, I guess, Jada, you and I had sort of mentioned we had a similar sort of experience in terms of feeling very positively in those first days and weeks of being a parent. I did have a very lovely experience. I didn't have I did cry, but it was happy cries most of the time. It was a really lovely experience. And when it isn't sort of fraught with lots of anxiety and difficulty emotionally, and you are able to sort of zoom in with and be in that little bubble with your child, which was lovely. And just getting to know her and getting to know myself as a mother was so intense and good, intense in a good way. And it was such a learning experience. I did have, in terms of the actual birth, some trouble in that area. I had a C-section, and I had a seroma, which means my incision opened. If there was fluid, my incision opened 2 weeks after birth. And so that was a journey. Getting better from that was a journey. My incision was open for a very long time. And so trying to, as Tovah was saying, I mean, just even having this plan in my mind for like, I'm going right back to the gym 6 weeks later, I was ready. And then, like, nope, you're not allowed to work out for 4 months. And like, so that was a challenging time with the whole body image thing was hard. But in terms of the bonding and getting to know my child, it was such an amazing time. And I just sort of encourage people to slow down, just like slow down and like really notice what's happening. I also did write a lot of things about that time. At the time, wrote about what my experience, and looking back on it now, almost 5 years later, I don't remember any of those things. When I read it, it's like, who was that person? I don't remember having that thought. I don't remember that experience at all. So I really do. I encourage people to write things down, because you just forget these little tiny moments. And it's amazing to have that. It's like, it feels like a gift to have a window into what it was like for me in that first month of being a mom, or first 2 months of being a mom. But yeah, it was a very unique experience, to say the least.
Yeah. Thank you. And Olivia, if you want to share anything.
Yeah. So when I had my daughter, I was the first in my cohort of friends to have a child. So I didn't know any other parents. And that was I felt very isolated at home. My husband went back to work really quickly after, so I was home with the baby all day long. Had never taken care of a baby. Didn't know what the heck I was doing. And so that was really quite, it was a difficult experience. It was a hard time. I think that I was, again, kind of sold the bill, or bought the bill of sunshine and rainbows. This is so great. Aren't you so happy? This is such a wonderful time. And it was sometimes. But a lot of times it was really, really challenging. I think then people don't really speak about the loss involved in your time. Certainly is not your own anymore. Your space is taken up. Babies are small, but their gear is numerous. I think that physically, the physical changes that we undergo, and the job, career-wise, that was a big shift in trying to figure out, how do I navigate this? How do I do this now? Changes in my relationship with my husband too. I think that figuring out how not to be ships in the night. I think, and that's why I think I always emphasize, really, Tovah, you said connection, how important that was. And I think that's critical. So you're actually, looking each other in the eye and saying, how are you doing? And as opposed to, the diaper was last changed at 2 o'clock and we need more milk. Kind of the transactional piece, I think, that people fall into, which is essential and that's critical as well. But I think that that's it. That it can become really isolating And I think that, I tip my hat to you, Tovah, giving birth during this time. I mean, I think it's isolating enough having a new baby. I think during the pandemic, it has been even more critical that people reach out. They get the support they need. They find online support groups, or they find online parenting groups, or just reach out to folks via FaceTime video calls, whatever you can do to kind of avoid that isolation. And my daughter was 2 when my twins were born. So I had a natural birth with my daughter and a very dedicated birth with my twins. They were breech stretchers, so there was no way they were coming out but via C-section. And so having gone through those 2 very different experiences of birth, that was very illuminating. But I got to say, the second time around, knowing what to expect and having that under my belt and knowing, okay, this is what it's like, allowed me really to prepare a lot more. So my goal, and what I always tell folks is, prepare as if you were having twins. In other words, line up extra support, get double what you think you're going to need, because inevitably, if you don't use it, great. If you do need it, then it's there.
Thank you for sharing that, both of you. Yeah, I think that's one of the, things people right now are going, well, but what kind of support? Nobody can come over. And that's why, we are doing postpartum doula work virtually. And just so that you all know, it's different how we're doing it, but sometimes we're just popping in throughout your day. So whereas in the past, of course, I would have come over and worked with you for several hours or slept overnight, and we can't do that right now. You might just maybe book a few hours, and maybe I pop in at 9 o'clock in the morning for an hour, and then at 1 o'clock I pop in again, and then at 5 o'clock I pop in again. And so you have this kind of consistency of a person who's just showing up for you and holding space for you. And also you can show me your poopy diaper and we can talk about whether that's normal or not, or talk about sleep or not sleep. And I think, so finding those support groups, knowing these different resources, just being able to talk about it. I think for me, it was a surprising time in that I would put myself in the anxious person camp. And when I had a baby, I was surprised that all of a sudden I had all my anxiety of my life went away in this very weird and profound way, where I was like, oh, I just have one thing to do in my life, and it's just to care for this little being. And for me, that gave me permission to stop. I guess I'm a small business owner and I own 2 companies, and I do a lot of things, and I'm always thinking and solving problems endlessly all day long. And I think for me, it was this incredible pause. And I was surprised by that. I didn't know that would happen. I had no idea, in fact. And so I just, there's so many different ways that this can go. And I think one of the things I would leave as a tip is, during this time period, the pandemic it's forcing us to nest in a way that we before had pressures to go out and meet lots of people once we had our baby, and we had to go show the baby and have all these people over. And I think in our culture, we're often fearful of wearing our babies or holding our babies too much. And I think that instinctively, if it feels right to hold your baby a lot, it's okay. Like, it's going to help you through this time, because we don't have a lot of other arms. I want to acknowledge that we don't have a lot of other arms, and just not to be afraid that your baby, will never be put down. Right now, if you're pregnant, you're holding the baby all the time. So any little putting down, which you're going to do, is a starting of that process. But I always like to just give people permission to be like, yeah, if your gut is that you want to hold the baby, or the baby falls asleep better on you, that's okay for a while, Any thoughts on that? From the, and then just any last thoughts, I think, to have any last tips or things that you want to share with people about, what treatment is available if it really is more serious, and or what can people do to just really start to feel better?
I would say there's no need to suffer. So if you're feeling things are off, if you're not feeling right, it's very treatable. So don't white knuckle it. Don't hesitate, because it's much easier to treat earlier. Unfortunately, I work with some folks that kind of waited until their child was 2, 3 years old, and they just tell me, I never felt great, which to me is a real shame, because they spent all this time, not feeling well, and that was unnecessary. There's something you can actually do about it. And again, it doesn't mean that you're weak. I think it means that you're really strong. If you do reach out for help, that to me indicates a real, strength and a desire to take action, which I think is really critical at that time.
Thank you. Yeah, Nanika.
I second all of those things. I think just reaching out in general, as everybody has been saying, connecting as much as you can with other people in whatever way that is, whether it's the video, whether it's a phone call, whether it's a socially distanced, wave, whatever it is. Yeah, trying as best you can to stay connected to other people and staying connected to yourself as well, and prioritizing your own needs, and realizing that this is the longest, shortest time, right? Like, it goes really fast and it also feels really long sometimes in the middle of the night. But it's very fleeting. And so, to be able to make anything easier for yourself so that you can enjoy that time, do that,
Yeah, I think really reminding people, right, that middle of the night, I think as much as we can when we first have babies, to recognize that the baby is going to lead this sleep, right? At first, in this beginning, like, they just are going to wake up a lot in the middle of the night, and they don't realize night is day and day is night. It's flip-flopped in the beginning. And I think that's part of, like, what Tovah said, kind of setting expectations. Be like, no, you're definitely not going to sleep 7 hours at night. It's just that it can't happen safely and healthily. The baby has to wake up to feed one way or another, and somebody has to wake up with the baby. And maybe it's not you, but right now it often is, because we are not having these overnight helpers. So yeah, Tovah.
Yeah, and 100%. So my personal experience the first time around, as I said, was really rough. Emotionally, I didn't know what to expect. I didn't know that I was going to bleed. Even though I had a C-section, I didn't know that I was going to be like so swollen that I didn't recognize myself, and I couldn't fit in my shoes because of the width of my feet. I didn't know that I would never be able to wear my shoes again because my feet have permanently changed size. I didn't know that my hair would fall out. Like, there were so many things that I didn't know that made the whole process, you're already sleep deprived. You're trying to take care of a human that you love more than anything you ever imagined you could possibly love. And that's jarring. Adding to it that the things that your body's going through and not being prepared for them emotionally or with, like, product, I think is just like, that's an unnecessary. Let's take it off the table. And for me this time around, I started Bodily because I had that experience, and these are normal physiological changes that we go through. They're, like, incredibly predictable, that you're going to bleed and that your hair is going to fall out. Like, these are just the things that your body does. And so I really do think that getting those expectations set, knowing what's going to happen, what's likely to happen, what might happen, having the things on hand so that you can take care of yourself appropriately. Because I 100% agree, if you are if you feel like a mess, if you feel like your own stuff is constantly in crisis, then you're not going to be able to be 100% for the thing that you want to be 100% for. We created products on our site that help you be prepared. We put them in a box so you don't even need to think about what you need, and made it all beautiful so that you can feel good about it. Everything from, like, the maxi pads that are giant because they need to be giant because it's not a period, it's way more than a period, to like nursing bras that are really beautiful and they feel really good and they're totally functional and they're good for your breasts, because breast health is really important. So there are resources out there. Created Bodily literally to make this process easier. Going through it the second time and being prepared is a game changer. You can be prepared. Just look for the resources. If you're a person who's gone through it, we talk about passing the birth baton at Bodily, and, like, tell somebody else. Don't not tell them that they're going to bleed because you're afraid you're going to scare them, because when they get there, if they didn't know that they were going to be emotional and you didn't tell them, like, no, it's not like a normal level of emotional. It's like a new level of emotional. They're not going to know to expect it. So I want to say those things. Like, if you've been through it, pass the birth baton, tell someone else, and get the things so that it's easier. And then the last thing from me is, I think it's really scary, can be really scary, pregnant, going in COVID and, isolation and kind of the whole thing all wrapped up in it. But one of the things that I think is really wonderful, like the silver lining here, is that we are all locked up. And when you just had a baby, we don't give societally, culturally in the United States the space and the time for people to recover from this crazy physiological process and to spend the time with the baby that you need to in those early days especially. And so, silver lining is you can't go anywhere. So you have the time now to spend the time with your baby that I think you should and have the ability to anyway if you choose. So.
Thank you. Well, thank you everybody. Thank you everybody so much for coming out and talking with us. It's been amazing to speak with all of you who are moms who have businesses and practices devoted to helping make new parents, birthing parents, partners, moms, dads, everybody, the family, healthier and better. And if you're not feeling healthy and better and well, then you have resources. You can always come to Boober or reach out to us for something that we don't have, and we will always try to find that resource or person or match you to the resource you need, which I think probably goes for all of us as resource kind of places. So in the chat, you have everybody's information. Again, Olivia Bergeron of Mommy Groove, Dr. Nanika Coor of Brooklyn Parent Therapy, Tovah Haim of of Bodily, because I was reading what I wrote. And I'm Jada Shapiro, founder of Boober and Birthday Presents. And we hope to hear from you soon and see you again. Thanks, everyone.